Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to this channel. In today's home exercise tutorial, we are going to start a two-part series on something called lateral trunk flexion. It is a pretty common problem, and I really don't get this question a lot in the comments, and I think that's probably because a lot of you might not be aware that you're doing this. I've broken this topic up into two parts. In today's video, we are going to go over what that is and some ways that you might be able to identify if that's something that you are struggling with, or what I would call a structural problem that might be limiting some of your movement, specifically walking. It is also an impairment or a structural problem that can sometimes cause low back pain. So I think it is a good topic to cover to help you guys just be able to guide you to the best exercises for your specific needs. And again, I do think this is a common problem, even if there's some of you out there who so far don't think that what I just described resonates with you. I think when I go through some of the causes of it, you might be able to identify with one of those causes that just might be able to help you figure out what the best exercises are for you to do to maximize your potential to get the most out of your movement in the most efficient manner with the least amount of pain and the least amount of long-term problems such as arthritis and things like that. Doing the correct exercises now really is setting you up for a lifetime after a stroke or a brain injury or MS to improve or maintain your functional movement, to improve or maintain your functional movement. So again, I've broken it down into two categories. In today's video, we're going to go over the causes and then some exercises, because I know that's what a lot of you want me to get to. And then in next week's video, we're going to take some of those exercises and transition them into activities that will carry over into walking. So how do you minimize this lateral trunk flexion when you are walking and doing other functional activities? But before we dive into that, if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. And now let's go ahead and dive in. So, lateral trunk flexion. What is this and what does it look like, or what could be some of the red flags that you could look for if you saw a video of your walking that would help you to identify if you have this kind of what I would call more of a structural problem than a movement problem. Some of the things that you should look for, or what I just called red flags, would be that when you look in the mirror, one side looks crunched in, usually your involved side, or the side opposite the side where the damage is in your brain. So a few ways you can identify this crunching or this shortening on one side or flexing to one side is look at your shoulder and your hip, and if they're closer together on one side than they are on the other side when you look in the mirror, then that would be a lateral trunk flexion. Also, when you're walking or standing, you could also look at this. Look at your shoulders and look at your hips and kind of judge just a guesstimate of the distance between your shoulder and your hip on one side and your shoulder and your hip on the other side. And if they are closer together on your involved side, then you probably are struggling, or you probably have this lateral trunk flexion on one side. Now, what are some of the things that can cause this to happen? The reason this is so important, and the reason that I'm making a video just devoted to this, is it is an asymmetry, and everything is connected from your foot to the tip of your head. And so if you have asymmetries and you continue to reinforce this pattern, there is the potential that you're going to end up with more injuries down the road. Most likely arthritic changes in your knees and your hips, and definitely a common complaint that I get is low back pain. So it is good to identify if you fall into this category, and then also be able to implement some of the strategies that I talk about later on in this video. But besides just looking at it, the reason I went on that little rant is what are some of the things that cause this, because these could also be clues that might lead you to believe that you struggle with this lateral trunk flexion. So some of the things that I've thought of that might potentially lead to this are if you have a shoulder subluxation. So although the shoulder is just the shoulder kind of dropping out of the socket, it's usually an indication that that whole upper quadrant is a little bit weak, including the shoulder blade. So that whole upper quadrant on your involved side just kind of collapses. So that is going to bring that shoulder and that hip a little bit closer together. The other thing that can cause this, and I should probably just have a standard list of problems that cause most of the movement problems I talk about, because I talk about this a lot, but spasticity. Spasticity is another reason that you might be collapsing on one side. So some of the muscles that are spastic that can cause this trunk flexion is your latissimus. So that causes the trunk to flex, and it is a really common muscle that becomes a little bit overactive or spastic. So I have talked about this a little bit before. That also causes the arm to internally rotate. The only reason I bring that up, if you're someone that your arm is really stuck in internal rotation, then you might be collapsing on this side of your body as well. And it can interfere with your walking and your posture in sitting and standing. So if you have a lot of arm spasticity, most likely that latissimus is a little spastic. Also, your pectoralis major, your pectoralis minor. I've talked about these muscles before because they are big culprits that become either spastic or shortened. And what that does is it kind of brings that shoulder blade forward, but kind of because of the angle of the pull of those pecs, it also brings that shoulder down closer to your hip. So that's another reason you might be flexing or shortened on the involved side of your body. The other thing that can cause you to collapse or be shortened on one side of your body is neglect. So I've done an entire video on neglect. I will put a link for that in the description below. If you've ever heard that term, heard your doctor or your therapist ever use that term and maybe suggest that this is something that you struggle with, you might also be someone that collapses on that side of your body. And the reason is you just have lack of awareness to that side of your body. So you have a tendency to just kind of be a little bit shifted more towards your stronger side. And when you're a little bit more shifted towards your uninvolved side or the stronger side of your body, the involved side kind of collapses or becomes a little bit shortened. And then the other reason, which is huge, 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 and that is learned non-use. And the other thing I will put in this category is using a one-handed assistive device. Learned non-use is where you learn to just use your stronger side for everything. I've done an entire video on this. I will also put a link for this video in the description below because I think it's hugely valuable to give you insight into many of your movement-related problems and then some solutions. So learned non-use or using a one-handed assistive device tends to shift all your weight to that stronger side of your body. When you shift, you are going to collapse on that involved side of your body. Not only that, you have support on the strong side or the uninvolved side of your body, and that support that goes all the way to the ground, it does kind of raise that shoulder up, which without question is going to cause collapsing on that side of your body. So one-handed assistive devices are a big problem. But I will give you some solutions, even if you've been using a one-handed assistive device for a really long time. Definitely watch this video to the end because I am going to give you some strategies to start unlearning that learned non-use or unlearn some of that reliance or dependence that you have on that one-handed assistive device. As I mentioned at the beginning, the activities that we're going to cover in this video are laying down exercises, sitting exercises. In next week's video, we're going to carry this over into standing and learn some strategies on how to carry that over into walking, as well as some little pro tips on how to minimize the subconscious habit of hiking that hip up or flexing on that side when you are walking. So I think it's hugely valuable, but again, that's in next week's video. What are some things that you can do to kind of what we refer to in the physical therapy world of just creating some more symmetry? So you're asymmetric right now. You've got one side that's a little bit longer and one side that's a little bit shorter. What can we do to balance that back out and create that elongation on the involved side to just even you out a little bit? So some key things you want to do is stretch or elongate the shortened side of your body to retrain your body to just reposition itself in a more neutral position so that your shoulders are even, your hips are even. And when you look at the distance between your shoulder and your hip on the left and the right, there's pretty much the same distance on both sides. So stretching and movement retraining in sitting and in standing. Now, the reason I say that and the reason I go through this from laying down to sitting to standing in most of the progressions that I do on this channel is because if you do have spasticity, the more challenged that your body feels, the more that spasticity is going to kick in. So if you have involuntary muscle contraction, the harder you make the activity, the more that spasticity is going to become a problem. You want to set yourself up for success. So you want to find the easiest position that you can do this in that is still challenging you to set yourself up for success. So the way I've structured this video is we're going to do some stretching and some active movement in laying down, some stretching and some active movement in sitting, and then some stretching and some active movement in standing, with the end goal of giving you activities that lengthen the involved side with the stretching, and then learning how to retrain your body to lengthen that involved side of your body in laying down, sitting, and standing. So starting laying down, the best stretch that you can do to elongate that involved side of your body is to just use a pillow. It's very cheap. Now, a regular pillow that you sleep on is usually not dense enough. So I will put a link for a pillow that I really, really like, that I think is extremely valuable for a lot of different activities, but definitely for this one. It's a little bit denser and it's not going to collapse on you as much, but you're basically just going to lay sideways on this pillow. You can see immediately how that's elongating that shortened side of the body. It's the best stretch you can do to stretch all those muscles out, stretch all that soft tissue out so that you are setting yourself up for the active activities that we're going to do next. But definitely lengthening all the soft tissue structures on that side of your body is critical to help you get the most out of the active movements that we're going to be performing. Now, if you can't get yourself on top of the pillow laying down, because that is a little bit challenging, you can do this in sitting as well, but I really do prefer it with you laying on your side, laying down, but it is a little bit more challenging for some of you to get into this position. So if you need to just sit and just set that pillow next to you, that's definitely going to work as well. I've mentioned this in a lot of other videos, but a mat table is probably one of the best investments you can make. You really want to do this on a firm surface if at all possible. I will put a link for a mat table in the description below that does fold up and fits underneath the bed. So definitely it's great for home therapy programs. Now that stretch is great, but an even better stretch is a stretch with this spine corrector. Now, this is a little bit more of an investment, but there are a ton of exercises that I do with this. If you are someone who wants to invest in this, put hashtag spine corrector in the comments, and I will do an entire video of everything I use this spine corrector for. I use it for squatting activities with patients. I use it to help teach patients to get on and off the floor in the early stages. You can use it for weight bearing on your elbows if you can't get your arms all the way straight. There's a lot of different things that I use this for. So hashtag spine corrector in the description below if you are interested in purchasing this and you want me to do an entire video of all the things just using this piece of equipment that I do. I will definitely put that into the list of future videos. Back to the spine corrector and stretching or elongating the involved side of your body. You're basically going to side sit on this and then just lay over it. I like to do this with the involved leg bent and with the involved leg straight. It also stretches different muscles in the hip and the thigh that are usually pretty tight, but definitely hits all those soft tissue structures that are usually shortened on the involved side of your body, and you're just gonna hold it. Now, I am lucky. I do have other pieces of equipment that I usually use just to support someone's head. You could use a chair or a couch or something just to support your head. I do think you need something to support your head just to keep your head and your neck in proper alignment. And now we're gonna move to sitting. So in sitting, I love this little rocker disc. If you've bought an air disc that I've showed in some of the other videos, that will work as well, but this thing works a lot better. So you're just gonna sit on this kind of half dome and really just elongate that shortened side of your body by putting your arm or your elbow on a chair or a stool or a table. So if you put this in a chair, you could set it on a table, and you can see how this immediately elongates that side of your body, and you're just gonna hold it. 30 seconds to a minute is what we recommend for most stretches. You can hold it longer if you want to, but a minimum of 30 to 60 seconds. And then using the same piece of equipment, you can go right into what we call lateral pelvic tilt. Now, the important one to do is to elongate the involved side of your body. If you're someone that has neglect that I talked about earlier, or any type of inattention to that side of your body, this will be extremely challenging at first because you are shifting your weight more towards your involved side, which is a little bit scary for a lot of people who do have that neglect. However, it's a great activity that is safer than in standing, so it is a good progression if you're trying to relearn how to be more aware of that side of your body. It is a good progression prior to standing up. And that is it for today's video. I hope that was helpful. Again, remember, this is just part one. So if this resonated with you at all, or these specific problems are something that you are struggling with or trying to overcome, definitely tune in for next week's video, because we're going to take this, and this is exactly how I set up an in-person treatment. We always, what I call, prepare the system. So this is a lot of preparing the system, lengthening or elongating the soft tissue structures on the shortened side, and relearning how to self-correct so that you have equal distance between the shoulder and the hip on both sides. And then usually what I do in a treatment is always carry this over into functional activities. So next week's video, we're gonna go into some standing exercises and then how to carry this over into walking. But if you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell. It is the only way you're gonna know when I upload new videos. I also now offer a membership program. If you are interested in supporting this channel and you have the means to do so, definitely join, support this channel. It really does help me to continue to provide these free resources for a lot of people all around the world that don't have access to quality rehab, or they don't have the financial means to afford it. So if you have the means and you want to support me and support that mission, definitely click on that join button. I also now offer a practitioner membership. I have been getting a lot more comments from physical therapists or physical therapy students, so I now am going to offer a practitioner membership where we're going to do a little bit of a deeper dive with a little bit more of the technical aspect and the hands-on aspect of some of the things that I talk about in these videos. These videos are not intended to be skilled. It's good to understand the what and the why, but the how is really the hands-on and the manual, and that is the gemstone to in-person therapy. So everything that I describe in these videos, they're intended for people to be able to implement your home exercise program if you are a neurophysical therapist, but it's not exactly skilled. The skilled component comes into the manual cueing and how you facilitate those movements. So if you are a practitioner and you want to go a little bit of a deeper dive into the manual cueing and how to facilitate some of these movements, definitely click on that join button, join the practitioner membership program. I enjoyed spending time with you all today, and I look forward to seeing you all in the next video.